Facing illness or disease is difficult for anyone, but more heart-wrenching when the patient is a child. Now, innovations in pediatric medicine are bringing new promise to children and their families.
She was 16 weeks early. She weighed 1.5 pounds.
Jenna Collini has had struggles her whole life. She is one of 750,000 Americans with cerebral palsy.
It's okay to be kind of different, and a little different.
In Jenna's case, the cerebral palsy was caused by a brain bleed at birth. She's had surgery to reset her legs, but still struggles to walk.
She'd fall over if she wasn't holding on to things.
Now this robot is helping Jenna to stand strong on her own 2 feet. Therapists at the Shriners Hospital in Chicago strap her in and hoist her up using a machine called the Locomat.
It feels very nice.
Robotic braces guide Jenna's gait and balance, and the robot provides consistent, repeated motion, teaching her how to walk all over again.
She tends to walk up on her toes, and with the foot lifters, they're holding her foot in a nice position to encourage her to land on her heel.
Even just a small amount of change in the gait can be really important for a child. It can help them be able to walk longer and farther. It may help just from the way a child looks.
After 6 months, Jenna feels a whole new sense of confidence.
My walking's not going to be as good as other children, but I'm doing very good.
Twinkle, twinkle, little star.
Amanda Anderson remembers when flu-like symptoms sent her to the hospital 2 years ago.
Did they come and see you in the hospital?
Yeah.
Tests showed something far more serious.
They told us that this was a very life-threatening thing, and she needed surgery right away.
Amanda had bleeding behind her eye from a ruptured aneurysm.
There was still a lot of unknowns at that point. Was it going to be successful? We have to be aware that we could lose our little girl.
To save Amanda, Dr. Robert Spetzler used a new technique he developed. It involves removing a small piece of bone above the eye, then going under the brain to repair the aneurysm.
We took a little blood vessel that was not essential on the other half of the brain and cut the end of it in such a way that we could, with tiny little suture, create a patch for where the aneurysm was and make that blood vessel whole again.
The procedure put Amanda's brain at less risk. She recovered without long-term damage.
She brings so much joy to our life and is a miracle to us that she's been through this and just recovered with such flying colors.
This one's too big.
That one's too big.
Woo! Like most preschoolers, Genevieve loves to slide and swing. But not long ago, she was a very sick little girl.
I heard something hit the floor. So I turned around and I looked, and she's just like face down on the floor.
It was the 3rd time little Genevieve had passed out in a week. So her mom, Sandra Hernandez, called the pediatrician.
He's like, I can hear her the way she's breathing, take her to emergency room right now.
There, doctors diagnosed a blood vessel disorder called pulmonary arterial hypertension.
Those vessels become very reactive and they constrict down. If not treated, it doesn't allow enough oxygen into the bloodstream to then circulate to the rest of the body.
The treatment, more terrifying than the diagnosis.
We just hear like heart transplant, lung transplant, so it was devastating.
To avoid a double transplant, doctors at Sunrise Children's Hospital in Las Vegas are giving children like Genevieve a very grown-up drug.
Yep. I was like, what? They said, yeah, the Viagra's due right now.
You heard it right, Viagra, better known as the little blue pill used to treat erectile dysfunction. Genevieve takes an easier-to-swallow form of the drug originally developed for another use.
Nitric oxide was developed for these types of issues related to lungs, and one of the byproducts was, hey, this medication also can dilate blood vessels in other parts of the body and treat things like erectile dysfunction.
But for children with pulmonary arterial hypertension, Viagra can be a lifesaver.
We have children who we send home who have issues related to high pressures in the lungs that can be on a medication like Viagra.
Though not a cure, doctors hope it can buy enough time to find one.
Sometimes I'll look at her and just like, I get choked up, like, it could be so different right now.